Hey everyone, welcome to the channel. I'm Dr. Barton Blackerby. I'm a vitreoretinal surgeon in St. Louis, Missouri, and today I'm going to talk to you about what to expect if you need to get an intravitreal injection. And while it sounds scary, intravitreal injections are very common. It's one of the most common procedures performed in the world and typically performed for conditions such as diabetes or macular degeneration. It may sound scary to get a needle put in the eye, but after this video I hope you're more comfortable with this and know what to expect when you go in for the first time. So let's go over a little anatomy before we dive into what the injection is actually like. I have here a model of the cross-section of the eye. The front of the eye are the parts that you can see, such as the colored part, that's your iris. But in the back of the eye we have a very important structure called the retina. Think of it as like the wallpaper of the room, it's what sees. And if you have bleeding or swelling in this part of the eye, you're probably going to get an intravitreal injection. But we don't do the injection on the back part of the eye. We do the injection here on the white part of the eye. So when you come in for an injection, you'll probably have an exam in a chair similar to this to see if you need an injection, and then your surgeon will lay you back and give you some numbing drops on the eye. Then there are various ways to numb the eye. The method that I use a little bit of some subconjunctival, a little bit of some like under the skin of the eye injection of lidocaine to numb that very well, and I let you sit for several minutes. Then I come back and I put a cleaning drop on the eye. This cleaning drop we use a lot is called betadine. If you have eye irritation after your injection, it's probably due to the betadine. You can use artificial tears and cold compresses to make that feel better, but sometimes they can feel quite severe, feel like something's in the eye. Don't worry though, by the next day, the majority of symptoms are all gone. Keep using the artificial tears and just keeping the eye shut so that it heals. The betadine is a necessary evil because it cleans the eye and helps prevent infections. Now, concerning the actual injection itself, it's really not as bad as you think. It's a little bit of medicine. What I'm talking about is barely anything here like a drop in the eye. And the needle we use is very, very tiny. It's tinier than any needle that you've probably ever seen before. So it's not like those that you would see if you went to another doctor's office. And what we do is we perform that injection just right here in the white part of the eye. You may have a bruise afterwards, and that's okay. Soreness and scratchiness that we talked about are okay too. Things to look out for after an injection though is if you have worsening pain, worsening vision, or a whole bunch of floaters and all of these getting worse over the next several days, you need to call your surgeon or be seen immediately because it could be a retinal detachment or an eye infection, which we call endophthalmitis. Most of the time these injections are handled very well though. And we usually don't do them once, but we may do them more than once depending on the underlying condition. But as you get these, you'll become more comfortable with them and you'll realize the sight-saving aspects of them, and it won't be so scary when you come in the next time. So I hope you learned something today. Feel free to like, subscribe, leave a comment. I'm happy to reach out and talk to you a little bit more about some of those things, and keep an eye out for new videos coming up. Thanks guys.